In the crucible of World War I, a silent adversary emerged, altering the course of history. Tonight, we delve into the forgotten chapter of the Spanish flu and its profound impact on the war, families worldwide, and the general population. The 1918 pandemic occurred in three waves. The first wave occurred around spring 1918 and was considered mild, but the highly fatal second wave was responsible for most of the deaths during the pandemic. As the world plunged into the chaos of World War I, an unseen enemy silently encroached. One of the first recorded cases was on March 11, 1918, at Fort Riley, Kansas. The crowded trenches and military barracks, the Spanish flu found fertile ground, spreading like wildfire among the battle-weary soldiers. The close quarters and unsanitary conditions became breeding grounds for the flu, jeopardizing the strength and morale of military forces. Mortality estimates of the 1918 influenza pandemic varied considerably.
Upwards of 500 million to a billion people in the world were sickened during the influenza outbreak of 1918-1919. And by the best estimates, mortality was possibly as high as 100 million people.
Beyond the front lines, the flu reached homes across continents, tearing families apart in a relentless grip. News of loved ones falling victim to the flu echoed through communities, leaving families grappling with grief, uncertainty, and an unprecedented sense of loss. In the fall of 1918, the Spanish flu descended upon Texas, leaving a trail of devastation in its wake. The virus, mistakenly named for its perceived origin due to widespread media coverage in Spain, spread quickly throughout the state, overwhelming the communities and health infrastructure. In Texas, the Spanish flu struck both urban centers and rural areas with equal ferocity. Major cities such as Houston, Dallas, and San Antonio saw hospitals filled beyond capacity, while smaller towns struggled to cope with the influx of patients. The lack of effective treatments and vaccines exacerbated the crisis, leaving healthcare workers and families feeling helpless in the face of the rapidly spreading disease. The impact of the Spanish flu on Texas was profound, with estimates suggesting that tens of thousands of Texans succumbed to the virus. The state's economy suffered as businesses closed and public gatherings were banned to slow the spread of disease. Schools, churches, and theaters shuttered their doors, disrupting daily life for millions of Texans. Yet, amidst the tragedy, stories of resilience emerge as communities rally together to provide aid and support to those affected. The Spanish flu pandemic of 1918 left an indelible mark on Texas, shaping public health policies and collective memory for generations to come. Soon, the silent adversary transcended borders, becoming a global pandemic that spared no corner of the earth. In most parts of the world, people's lives were filled with very poor health, overcrowding, poor sanitation, and low hygiene standards. Urban centers and rural communities alike faced the onslaught of the virus, overwhelming healthcare systems and sending shockwaves through societies unprepared for the scale of this invisible menace. The disease was not well understood. There were no antiviral medications to inhibit its progression or antibiotics to treat the complicating pneumonia that often followed.
Uncertain what the pathogen was, what the causative agent. People thought that it was bacterial or bacillus, or so we didn't really know, and we didn't have treatments, and a lot of people died not just because of the virus, but because of the secondary bacterial infections, and this was before we had antibiotics.
The Spanish flu didn't merely affect bodies, it shifted the very tides of World War I, leaving an indelible mark on the course of history. Political leaders faced internal crisis as the flu strained resources and diverted attention from the war effort. The Great War created a severe civilian nursing shortage. 9,000 trained white nurses were sent overseas and thousands more were assigned to U.S. military camps. The delicate balance of power on the world stage was reshaped by this unforeseen adversary.
Leading cause of death among soldiers in World War I was influenza. So, yeah, it certainly affected the war. It affected the world. It affected the political constitution of Europe following the war. It was nothing like it in human history.
Amid the chaos and despair, stories of resilience emerged, individuals and communities rising against the odds. Communities around the world united to support one another, showcasing the human spirit's ability to endure even in the face of unprecedented challenges. As the war concluded, the world sought to rebuild. the Spanish flu left an enduring legacy that echoed through generations. The pandemic's impact extended beyond the immediate aftermath, influencing healthcare policies, societal structures, and reshaping the world's approach to public health. Tonight we've journeyed through a forgotten chapter in history where the silent adversary of the Spanish flu intertwined with the tumultuous events of World War I and its impact on Texas, leaving an indelible mark on the families and communities around the globe. As we reflect these echoes from the past, let us remember the resilience of the human spirit that prevailed. Even in the darkest days of a silent and relentless adversary, the legacy of those times still resonate today, a testament to the strength of the human bond and our ability to endure through the most challenging of circumstances.